Today, we are talking about the efforts to save our community, our livelihood, the economy. We need to save jobs, save lives, both from the virus, but also from self-harm due to mental health. We need to save our children and grandchildren's educational systems so that they will be prepared to care for us in the future. And the time to save all of those things is right now, and the task is massive. One segment of this fight is represented here today by the Ohio Hotel and Lodging Association. It was founded in 1893 to stop hustlers from passing bad $5 bills as payments to hotels. It expanded its role and to include educational opportunities and would establish a legislative voice for the hospitality industry. Today, the Ohio Hotel and Lodging Association provides advocacy, information, resources, and education for operators and professionals in every type of lodging business across the state. OHLA supports efforts to grow Ohio's travel economy, provide jobs for hospitality professionals, and to maintain a prosperous hotel and lodging market. This industry is in jeopardy along with many other segments of Ohio's economy. It just doesn't get the press that restaurants and some of the other areas do. Hurrying along, it's my honor to introduce Joe Savarice, the Executive Director of the Ohio Hotel and Lodging Association. Before joining OHLA, he was a Senior Vice President with the Business Industry Political Action Committee based in Washington, D.C., a position he took back in 2007. There he oversaw a national field team and the deployment of an employer-to-employee communication and education program known as the Prosperity Project in states across the nation. An Ohio native, born in Ashtabula, he is a graduate of the E.W. Scripps School of Journalism at Ohio University. And Joe and his wife, Stacy, are residents of Pickerington. So Joe, we'll turn it over to you.
Well, thank you, Jim. And I just want to say that one of the bright spots of this dark year has been getting to know Jim a little better and starting to work on some things that we have underway. And he has been not only a good friend and partner of the organization, but also personally and very positive in terms of buoying our spirits every time we talk. So thank you, Jim. I'm so grateful that we have a lot ahead of us. And to my new friend, Rob, I just want to say, Rob, I'm not giving up the tie either. They will pry it off of my cold, dead neck because I like wearing my ties. So gosh darn it, I'm with you, brother. We're gonna keep it up. My father would be upset if he knew how often I came to work without a tie. So. But I do want to take this opportunity to talk a little bit about the travel economy. And I'm glad that Jim used the word travel economy because that is really what we focus and work on as the Hotel and Lodging Association. We are a big part, perhaps in many ways, the biggest part of that overall travel economy. And the travel economy encompasses so much because I did work for a national organization based in Washington before I took this job. And I traveled around the country for 8 years. And in my busiest year, I traveled 46 out of 52 weeks. It was the busiest year of travel that I had. But during that time, I was never a tourist. And we talk about the tourism economy a lot. And I like to think of the tourism economy as a subset of the overall travel economy, because the overall travel economy is so important, not only to this state, but to Central Ohio and the greater Columbus marketplace, where we have such a strong market for business meetings, conferences, events like the American Society of Association Executives, which were here last year, that there's so much to what we do beyond tourism, which a lot of people assign, that discretionary and leisure travel component, which is also very big within our state and within our market. But the travel economy is big business and it involves business. And that business has taken a hit this year. And I wanted to talk a little bit about how this important economic sector has fared during the disruption this year, during the pandemic, where things stand today, and then what we can look forward to with some hope and positivity in terms of the news that we've seen recently, and that today were the first vaccinations in the state of Ohio. What does that mean from a travel economy perspective? So I hope to walk through a little bit of that and take any questions. Please feel free along the way to interject as well. What happened with hotels in this state and in Central Ohio at the onset of the pandemic? Well, it's important to recognize that hotels and all lodging businesses were categorized as essential services in the state of Ohio, and they did remain open even when other businesses were forced to close. Now, initially during that phase, parts of our business, such as meetings and events and banquets and conferences and conventions, were not allowed. And the first event in Ohio that was impacted by the pandemic was the Arnold Sports Festival here in Greater Columbus, which takes on a multitude of venues and is the biggest event that we do all year. If you don't know about that, it's much bigger than any of the OSU events or other conferences or conventions that we have. And that was the first thing that was disrupted in early March. Beginning in about the first week of June, events of up to 300 people were permitted to be held again in hotel and other meeting venues. And we have largely been operating under those guidelines consistently since that time, with a constraint of you can't have a meeting larger than 300. When you think about the hundreds of events that we do in Central Ohio every year that have thousands of attendees, this was massively disruptive to our industry and the people that work within it. And many groups not only canceled or had events impacted just during the first stages of those orders when we couldn't hold events, and then when we couldn't hold events of more than 300 people, but they're still canceling events well into 2021. And I've actually had some hotels talk to us about groups that have reached out about potentially canceling events that are as far out as early 2022 because of the uncertainty in terms of the orders, what they are and aren't able to do with their events, the commitments that they need to make ahead of time. And we're trying to hold people off from doing that into late 2021 and 2022, because with the vaccines, as we'll talk about in just a minute, we are seeing that we do think we will have more flexibility and travel business will open up as we get into later this coming year. But in terms of this current year that we're in, 2020, what we saw almost overnight, within a matter of 3 weeks this happened, there was an impact on jobs in our industry unlike any that I have ever read about in history, and I'm still searching for examples, to find an industry that lost 70% of its directly employed workforce in a period of less than 3 weeks. In Ohio, more than 43,000 people work directly for hotel and lodging properties. And about 30,000 of those jobs, or about 70% of those jobs, were laid off, furloughed, or terminated within a less than 3 week time span. This is just absolutely catastrophic economic impacts cascading through the industry with the speed of lightning. In addition to those people that we employ directly, hotel and lodging businesses support 192,000 jobs throughout the state. And you have to think about the many companies that rely on hotel business, but they may not be employed by a hotel. A valet parking company is a perfect example. Our landscapers, some of our cleaning companies, laundry companies, anybody that works outside the hotel structure, but whose livelihood depends on the operation of that hotel. And of those 192,000 jobs, more than 87,000 of those jobs were impacted in a very quick period of time, in about a 3 to 4 week time span as well. So just half, about 45% of those jobs. Now that happened very early in late March and early April, but we still haven't been able to bring back slightly more than half of those direct jobs. Of those 30,000 people that worked in hotels, we've only been able to bring back about half of those folks. So the impacts in terms of unemployment rate are, I think, disproportionate within our industry. And we have taken some steps to help with that. We have created a Hospitality Helping Hands is the name of our fund, which has made grants and provided other assistance to displaced hotel and lodging workers and other hospitality workers and their families. And we continue to work on that because we know we're going to need that support into next year. Now, while hotels were impacted very immediately economically and saw many of them business drop from 40, 50, 60% occupancy levels to less than 10% occupancy virtually, again, overnight within the matter of just a few days, hotel and lodging businesses fought to keep the doors open. And one reason why is because they were part of the response to the pandemic. And in addition to providing accommodations to travelers who still were traveling throughout the country and needed places to stay, even when these closure orders were happening, hotels are also servicing first responders and others who are necessary to fighting the spread of COVID-19 or otherwise responding to emergencies and disasters, because we still had those even while the pandemic was going on. We're housing medical professionals and hospital workers, many of whom are working double and triple shifts and don't want to expose people at home potentially to the virus when they are working within the virus within the hospital. Essential government workers, homeless clients and at-risk populations, taking them out of those congregate environments where the disease spreads like wildfire and putting them into much safer environments. Many hotels are working with local homeless agencies and other human services agencies to house people that are at risk or homeless. And there are many newly homeless people since March that never experienced that problem before, but are experiencing it now because of the impact on our economy. And then hotels are also servicing those who are engaged in essential businesses and operations, including our transportation and logistics sector, which we obviously realize now how important that is because we are relying on that for the distribution of vaccine and others critical to the state's response. All in all, we had more than 600 hotels in Ohio that volunteered to be temporarily used as healthcare related facilities or overflow facilities or isolation and quarantine or otherwise directly help the response. And that's a pretty sizable number. It was about between 600 and 700, probably about 650 is where we topped out. And there are only 1,500 licensed hotels in the state of Ohio. So there's a finite number of hotels. And that was a pretty incredible showing, especially for businesses that were fighting to survive and just keep the doors open and be able to pay the bills. Hotels have also been engaged in other forms of response and helping the community, including providing meals to different populations, donating items to organizations that have been collecting supplies for the elderly and others who couldn't get out to get those supplies on their own, things like toiletries and other necessities that hotels did have supplies of. And in fact, for a period of time, had a little bit of an excess supply because there just were no guests that were using those materials. So we're proud of the response that hotels put forth and fought to keep the doors open because they're part of this essential infrastructure. So where does that leave us in terms of what the state of our business is and where we are with travel now? Well, to give you some context, in a normal year, visitors make about 43 million trips to the greater Columbus market for conventions, trade shows, leisure travel, sporting events, you name it, visiting family, 43 million trips. And that leads to $7.6 billion in visitor spending. And the numbers that I was using for jobs before were statewide. Around Central Ohio in the Columbus market, that equates to just under 80,000 jobs here, impacted jobs and direct jobs in our marketplace. But the figures that we have now show that travel spending, that $7.6 billion, will be down by at least 45% versus 2019, our last full year, by the end of this year. And some of us think that's a little conservative. It probably will be a little closer to 50 or a little above. But given the numbers we have, we already know there's a 45% loss in that economic activity. The way that that manifests itself for hotels is through a couple of key metrics. The most important one is occupancy. And for the last full month, October, which is normally our busiest month of the year in the state of Ohio and locally, the year-to-date numbers, including that busiest month, show that we had an occupancy rate of about 40% year-to-date when we should have had about 63% hotel occupancy year-to-date through October. So a pretty massive impact on the amount of business, wages, taxes, economic activity that's lost. By all of our metrics, we absolutely are going to have already the worst year on record in the history of the hotel industry. Worse than 2 world wars, a Great Depression, the 2008 economic downturn, you name it. This is going to be already the worst year on record. And next year's only going to be a little bit better. We'll talk about that in just a moment. For the week, we look at numbers not only year to date and monthly, but we look at them weekly. And for the week ending November 28th, one of the last weeks that we had, hotel occupancy already started to dip below the 20 percentile level for Ohio at a time when it should be closer to 60%. There are some large convention center meeting hotels in the state of Ohio that are operating between 10 and 13% occupancy. Now in our business, when you're at about 20% occupancy, when you're about 20% of the amount of business that you could be doing, most hotels would be taking a hard look at closing the doors because you're at below sustainable levels. But all of these operators are fighting to keep the doors open, to be part of the response, to make it over the hump, to build a bridge to get into next year when we will see things start to pump up. But the numbers aren't good in the short term. And I told Hallie, and Jim knows this about me too, you know, I never sugarcoat it. And if we're talking about the state of the industry right now, the state is pretty troubling. We do regular surveying of our members, and the last survey that we had was just a couple of Fridays ago, closed. So these are about 2-week-old numbers. But at that time, 71% of our businesses said they will not make it another 6 months of keeping the doors open at current levels of business unless there is some additional support, be that from federal level, state level, from the federal level flowing through the state, or combination thereof. Even though we haven't brought back half of those people that were displaced in March and April, 77% of our members are saying they are preparing for another round of layoff and job loss. And 68% of them are already operating at less than half of their pandemic levels. If you have been in a hotel lately, you'll see a lot of good things. I'm going to talk about some things they're doing to create safe environments, but one thing you'll notice is less staff. And our team members are not just doing 2 or 3 jobs, they're doing 5 or 6 jobs. I have one member hotel that had 107 team members, and there are 7 people operating that hotel right now. And that's not unusual. It is just absolutely unbelievable, the effort that it's Herculean that they're putting forth to keep the doors open. 59% of our members report that they are in danger of foreclosure. There definitely are some fundamental financing and lending issues. And many of our hotels were not able to access the Paycheck Protection Program, PPP loans, because of the nature of some of their financing. And we're trying to work through some legislative and regulatory solutions to that. But right now, they still don't have that flexibility. The tax implications, as I mentioned, are just absolutely astronomical. There has been $12.2 billion in total lost visitor spending across the entire state. And that number was as of October, so not even through November yet. And that equated to more than $760 million in lost federal tax revenue, $360 million in state tax revenue, and $212 million in local tax revenue. The impact's going to keep cascading through these governments that aren't going to realize the revenue that was there earlier. And this is just from travel economy loss, not from other businesses as well. But I think that our losses are disproportionate, and that's really going to hurt local governments, which rely on lodging tax. In the state of Ohio, lodging tax is levied and collected at the local level. It is not a state tax, and that money is used for not only convention and visitors bureaus and destination marketing, but it's also used for programs such as affordable housing, helping the homeless, arts, other humanities programs, social services, and basic municipal services. And municipalities and counties throughout Ohio are going to see a huge impact on that in the coming months. So what do we see looking ahead? Where are the bright spots, if there are any out there looking ahead? Well, going into Thanksgiving, we knew that 72% of people surveyed said that they were unlikely to travel. Now in Ohio, that number ended up being down about 50% by the various measurements that we were looking at: road travel, air travel, other types of travel. So not as high as the consumer sentiment number, but there's a downside to that too. That also means that we're going to see that post-Thanksgiving spike in some of the numbers that we are seeing when you look at the numbers over the past couple of weeks, but certainly the past few days, where we are now regularly hovering around 10,000 new cases. So a similar percentage, 69%, said that they are unlikely to travel for the December holidays. And we think that that number will hold more than the Thanksgiving number did, because people are seeing the spike in new cases, in part because of the traveling and the getting together for Thanksgiving. So that might depress travel and spending around the December holidays. Looking ahead into the spring, a like number, 65% say they're unlikely to travel for spring break or spring vacation. Unlikely to travel. Only 30% of people have taken an overnight leisure trip since March, which is a pretty low number. But what astounds me is that only 8% have taken an overnight business trip in that same period of time. And clearly the business numbers are important for us. We get volume through leisure travel, but you get dollars through business travel because you're getting higher rates, et cetera. 8% overnight business trips since the onset of the pandemic is just absolutely the most catastrophic illustration I can talk about in terms of loss of business. And the same percentage, 8%, expect to travel in the next 6 months. So it's not looking better from a business travel perspective. And we all know many companies, many people that we work with have travel policies in place, and they're not looking to change those just yet. Today's the first day of vaccinations in the state of Ohio, and that's a good thing. But it's certainly going to take some time before we see some of those policies and requirements that are in place now. And 44% of people are saying their next discretionary trip will be more than a year from now. So not quite half are saying, I'll probably put it off, any travel that I have a choice of doing until more than a year from now. How does that relate to the vaccine? About 40%, 41% of people said it's the vaccine they're waiting for before they will travel. So that's a good sign that the vaccine has materialized sooner than many people thought would be possible. And 62% of people have some travel plans in the next 6 months because they might have meetings, events, or business teed up, but 74% of them say they expect that to change in some way. Now that could be a positive change. People could say, I am going to be able to travel for work, or people could be pulling back from travel because they're not ready yet. So it's just a very fluid situation. And each month we've seen the numbers break and get actually worse. We had a little bit of pent-up travel demand when the first stay-at-home and closure orders, that first round, were lifted around the country in summer when we got into the summer months. But that leisure blip lasted for a brief period of time and then came right back down. Because Hallie especially, and she is my bright spot, so because she was lobbying me to make sure that we talk about some bright spots and positive news out there, the positive news is the advent of the vaccine and the vaccine rollout. And we've actually seen that in some metrics that we've started to get some initial response from, although we won't see a lot of hard numbers yet, still for a few weeks and months. But for example, one day after Pfizer announced the vaccine was highly effective, and we had that first big announcement, several of the major search sites saw significant increases in searches for flights and accommodations and other travel decisions. And it was almost 30% above the previous week, which was the largest single day increase since when the pent-up demand happened, when they lessened the closure orders back in June, July. So we do know that the news of the vaccine is making people look again at when I might be able to travel, both for business and leisure discretionary. On one of the booking sites, just US bookings only, not international bookings, rose 25% the same day, one day after the Pfizer news. But after about a couple of weeks, airline bookings especially started to stall out because we got good news about the vaccines, but then we got bad news about the spike and rise in cases. So consumers are balancing that out in terms of consumer sentiment. Great news about the vaccine, but we are seeing numbers that a lot of people thought would never happen and were unrealistic. I remember when the former state health director said 10,000 new cases a day, and she took a lot of derision for that, and that was not realistic. Now 10,000 cases a day is reality. It is the norm. So people are still weighing that news. So what's our way forward? If we want to think about this, if we want to think about that impact on our economy that we were talking about in the setup to what I was going to discuss, here are some things that we can all think about. Currently, right now, less than a third of people surveyed across the country say that they support the idea of opening up their community to visitors. People are still very reluctant about meetings and events and having people visit our destinations. But that's where that economic activity is derived from. And in Columbus, we were on the cusp of reaching a whole new level in terms of being a national and international player in the meetings and events business after the investment the community made in the American Society of Association Executives convention, and all of those people then bring their convention to a city that they visited and had, by all accounts, the best experience that they had at any of those meetings. So we have to work within the community to help people understand how we can do these things safely so they do feel more supportive of opening the community back up. And at the same time, only about 40% of people right now are saying they feel safe traveling outside of their community. So that's us bringing that economic activity everywhere else. And that goes to, again, the news about the vaccine, but the numbers and balancing that, but also having an understanding of what happens within travel economy businesses, hotels, meeting venues, convention centers, even restaurants, et cetera, all of those partners working together. Some areas, and especially in Ohio, this is true, like my members down in Southeast Ohio and Hocking Hills had particularly good falls and did very well because people are looking for alternatives to travel. Maybe they don't want to go to an urban environment, a city center environment, a crowded area, an amusement park, but they will go to a place like Hocking Hills where they can have a cabin and all the space that they want. And Ohio has one of the best unique lodging markets in the entire country. We have some of the highest rated properties in the world. So we can leverage that and take advantage of that. And we're also well situated because Ohio's drivability to a large portion of the country's population is also off the charts. We are, by all accounts, a one-day drive for more than 50% of the United States population. As people might still be reluctant to fly, we have to capitalize on our drivability and the fact that we can be reached by so much of the country by driving. And we are working on that. We are talking to the folks that will be marketing travel when we can open events back up about emphasizing that. Business travel is still projected to grow once we get through the short term, and it'll grow at a compounded annual rate of roughly 13 to 14% through 2026. So this is a short-term disruption, but business travel on the whole does continue to grow. And that's why, from a public policy perspective, we argue we don't need a bailout. Probably like some of our partners in the airlines and some other industries. But what we do need is help building a bridge, because business is going to come back, and it's going to start coming back late summer, early fall of next year. That's when we'll get back to some sustainability levels. It'll be at least 2023 before we get back to 2019 levels, but we can get back to sustainability and being able to start to bring back more associates and make debt payments and all of those things that we need to do as business owners by late summer, early fall of next year, especially with the advent of the vaccines. So how are we going to be able to do that? Why am I confident that we will see things come back? Because one of the biggest things that we're working on right now is how our operations keep guests and employees safe, but also boost that consumer confidence by explaining that. And I've had people ask me and say, is it really safe to stay in a hotel? I'm not sure I feel safe staying in a hotel. And I tell you in all sincerity that hotel environments are some of the safest places that you could stay in or visit or be in right now. First of all, hotel and lodging venues always prioritize steps to combat the transmission of all diseases. And certainly there have been periods through history where we've seen things happen in hotel environments, and they took the steps to help counter that and have gotten very sophisticated at that. But these protocols have been greatly increased since the advent of COVID-19. Every national hotel brand and the associations, our associations and the National Association, are collaborating on increased trainings and standards and protocols. We have a checklist for properties that can help them earn recognition for taking every step that they can to make sure that they are putting forth a safe environment. And some of those steps are things that you don't always see because they happen behind the scenes, but you're going to start to see those more as we work to educate the public. More effective but environmentally sound cleaning agents. There have been great advances in that, just like on the vaccine side. On the disinfectant side, that's not talked about as much. We have some really leading edge technology like ultraviolet disinfection, and you're going to see autonomous and robotic systems in our properties that are cleaning to whole new standards. I've seen these machines in practice. It's amazing how the UV can penetrate cracks and crevices and what that can do for the environment. And then it ionizes the air. It smells like you just had a rainstorm after the whole thing is done. It is amazing what these things do for the air. And our members are investing in the highest quality air handling and air purification systems on the HVAC side. I think that our properties will be leading that effort because they have a regular property improvement program schedule, and they are moving money into HVAC to make this the current thing that they upgrade and work on. And we have many partner companies of ours that are introducing new technologies on the HVAC side, which just absolutely do things that we couldn't do with the air even just a couple of years ago. But practices are the most important thing. Limiting housekeeping contacts so you don't have as many people coming into a room once you're checked in. And most guests don't want anybody coming in for the time being once they've checked in. And we're putting those standards in place to make sure that we're reflecting those guest preferences. Our properties adhere to safety protocols which exceed the state standards and requirements. They're actually, the hotel protocols are stronger than what the state requires, including the use of masks, which is not discretionary within every hotel that I've talked to, and businesses do have the ability to say there are no exemptions for masks. And every hotel that I've talked to about masks has a zero tolerance mask policy. The disinfecting happens at an accelerated pace. The spacing requirements in terms of keeping the social distancing is really just unparalleled for any other kind of business. So I think that they are making huge strides in that regard. And what we will do, working with the community, and I hope some of you will see this as we get into January of next year, is we will start to demonstrate that for the media, for the elected officials, for groups that are considering holding their events and others. We're going to start to demonstrate how it is that these properties put on safe meetings and events, why it is safe to stay in a hotel room, all of the technology involved, so people will have a better understanding. You don't know what you don't know. And if you don't see the steps being taken behind the scenes, you don't know how safe these properties are. But I'll put the things that we are doing up against every industry, and that includes the healthcare industry as well, because I visited the hotels, seen the investment that they're making, and it's costing dollars to do these things. But you can't put a price on guest safety, employee safety, and building that consumer confidence. And as we start to get our Safe Stay program, as it's branded out there, and other similar programs for venues and convention centers and restaurants, you'll start to see these certifications and recognition that these businesses have done everything that they can to keep that environment safe. And I think that's when that consumer confidence, coupled with the vaccine news, will start to tick up. And as we get into summer, and that takes hold, late summer, early fall, we'll see a return to normalcy as we get into the later part of the year. Record low first quarter. Everybody in our organization is budgeting for their worst quarter in history for Q1 2021. So there's no doubt it's going to get a little worse before it gets a little better. But there is light at the end of the tunnel, and it's not another train. It's the end of the tunnel. We just have to keep fighting and keep the doors open to get there. So I hope that paints a realistic and slightly positive picture, although we have some tough days ahead. And I'd be happy to field any questions, or Jim, if there's anything that you saw come in chat-wise you want to share, I'm happy to do that.
Well, first I'm going to say I should have introduced Hallie in the beginning, because my introduction was really just pitch hitting for her. Hallie is the Director of Strategy Engagement for the OHLA and has been there since 2015. So Hallie, thank you for bringing this program to Rotary for us. And I'm not expecting a response from you. I only saw one thing in the chat, and well, okay, maybe there's more now. And so we've got a kind of a question-ish thing, and it had to do with, okay, so even if we're vaccinated, but the CDC is not willing to say we're not still carriers, how does that impact the tactics to limit the exposure and virus in the hotel lodging industry? I think it's stay the course of what you're doing now, but I'll let you answer.
Well, there's no doubt, I am not a proponent that the first vaccines happening today means this is turned around right away. This is going to take months as we start to figure out some of those questions. What impact does it have on transmission, et cetera? And we don't have the answer to that. I'm a proponent that right now the numbers are worst case scenario from what we thought back in April and May, and we're at those numbers now. So we do need to be safe. And we are not advocating a return to large meetings yet. We are advocating strict adherence to the toughest protocols out there because it'll take months. The vaccine does not mean that we're going to flip a switch in January and start to see that travel come back. And it doesn't behoove us to think that that will be the case either, because I'm the one out there arguing right now to say if the numbers and the rates that we're seeing this week, last week, next week continue, that's just going to retard our recovery. You know, we've first got to focus on the here and now. And basically, there are no large meetings going on in hotels, but there are other things going on where there are still large meetings, events, and other things happening. And you know, I think we need to have a little bit of parity in that regard, get a handle on the numbers first, figure out the impact of the vaccines. And that's why we won't know those answers until summer and fall when people make decisions about coming back.
Well, thank you, Bill Wayhoff, for that question. And then tagged onto that, he asked the question, are you aware of larger hotels in Columbus that have actually shuttered permanently?
Yes, the answer is yes. And I get calls and asks from the media and others quite frequently to say, tell me which hotels have closed. And we don't do that. And there's a reason why we don't do that. There is not a hotel in the world, except for maybe the hotel that was in The Shining, that is designed to be closed. There are not chain link fences around our properties. Our businesses were designed to be open 24/7, 365. Every hotel that's closed, even if it's only temporarily, is at risk. It's at risk of vandalism, theft, intrusion, and you know, I have a lot of owners and members and operators who were very concerned while they were temporarily closing hotels, you know, to have that information out there. But we certainly did see, and if you search, you'll find information about some of the larger convention type hotels that temporarily closed here and in other cities in Ohio. More of those have come back online. The number of temporarily closed hotels right now is relatively small, but ask me that question again in another 4 weeks and I think we'll have an uptick, because we're going to have the lowest numbers ever in January. I think we might see some more temporary closures.
Thank you. And then Hugo Trucks asked the question, and this is interesting, Hugo. The part of staying in a hotel also includes eating in restaurants. And for him and for others, I'm sure that's more of a concern. Are restaurants as safe as hotels? And then he's got an add-on question, which I'll take separately.
Well, I think that restaurant environments that adhere to the requirements and guidelines are as safe as hotels or any other venue. And that's what it's all about. It's about making sure to adhere and comply with those guidelines. And I think that most owners and operators are 100% committed to doing that, because the restaurant universe is so much larger than the hotel universe. There are tens of thousands of restaurants and even more taverns and bars in Ohio. We've certainly seen instances, outliers, where there are some people saying we're not going to comply and making that into, whether it's a political statement or a social statement or whatever they're trying to do with that. But I think that that is absolutely the small minority. And most restaurant operators, including hotels that operate restaurants, have shown they can do that safely by limiting occupancy, keeping people distanced, the safe protocols that they could take. And we haven't seen, we've continued to ask the state, but we haven't seen evidence of contact tracing or other data which showed, well, there were large outbreaks that were tied back to you know, restaurant environments or events where they follow those protocols. And that's why the governor continues to emphasize the fact that it is social events, largely family events and family environments where people put their guard down, as he put it, and stop following the guidelines, like we're going to take our masks off because this is a celebration. That's where they're able to trace things back and see that there is a, you know, that there is a problem. So the ones that are doing the necessary steps, I think absolutely are as safe as every environment.
Well, thank you. And I know we're pushing time. Manana, who works in the industry, Manana, you need to unmute yourself to ask your question.
I think, am I unmuted?
You're on.
Okay, yeah, thank you. Great presentation. I do have a question. I think where hotels do see an opportunity during these next few months is medical workers, military, National Guards administrating the vaccines, whether it's hospitals, CVS, Walgreens. What is OHLA doing to help bridge that for hotels?
Well, we've been talking to the emergency management agencies, the EMAs, about that, and the EMAs have some thoughts about that as well. You know, there needs to be a discussion among the entities and businesses that see that as a potential. Some of the authorities that we've worked with said that there's a limited potential for doing that. So we've been discussing that with them about what really is, you know, or isn't the potential, and, you know, trying to be realistic and working with the members about what that business, you know, may or may not look like. To be frank, some of the EMA authorities that we're working with said that some of the hotels think that there's more business there than there might be.
Thank you.
But we leave no stone unturned either. So, and I also think that it's a valid question because things change. I don't think they know yet everything that's going to happen with vaccine distribution, and us banging on the door and saying, you know, we can help as that process evolves. First of all, I think it's going to be much more daunting than they realize. We're talking about small numbers initially, but what happens when we start to expand that number and it's not just this phase one? You know, phase one is so limited. Then I think, you know, we can make the case to say you're going to need some, I call it infrastructure. We are infrastructure.
Well, thank you very much. I'll turn this back to Chip. I think it's well known that there's a lot about this virus we don't know. But Joe, it's great to see you today. Talk to you soon. Chip, back to you.
Thanks, Jim. Thanks, Joe. Great presentation, I think. Enlightening to understand some of the things the hotel industry has been trying to do in the background as we've all fought through this crazy year. So appreciate your insight. Maybe we'll have you back after, maybe this time next year, we can have really good positive update. How about that? All right. Thanks, Joe. Well, I want to thank you for joining today. Please continue to spread the word. Let our members, friends, and others know that they're certainly welcome to join us each Monday at noon. Next week, we're going to hear from Carlton Moore with the Ohio Office of Criminal Justice Services. All right, everybody have a great week. We'll see you next Monday.
Thank you.
We're adjourned.